Good evening, everybody. Welcome to this APNA briefing on this fantastic Tuesday, the 29th of August. Thank you so much for joining us this evening. We've got a fair few nurses joining us from all over the country, which is fantastic. And we're talking all about professional indemnity insurance tonight. And why it is important for you and in your professional practice. But let's get underway with a acknowledgement to country. So APNA acknowledges the traditional custodians on the land on which we meet, and we pay respect to their elders past and present. Well, good evening. My name is Mitch. I'm the General Manager here at APNA, and we've got a star-studded lineup tonight. Lots of smiling faces here with lots of interesting things to tell you about professional indemnity insurance and also about APNA. So we've got Sam Moses, who's our APNA founder. Sam's an RN and she works on the team here at APNA, and she is going to be giving the sort of what I like to call the nursiness around the insurance to make sure that it resonates with nurses out there. We've got Carly Catalano, our Membership and Engagement Manager, and then joining us from insurance.com.au, formerly known as Insurance House, is Dominique Riquin, the Chief Executive Officer, and David Chan, the General Manager, both of insurance.com.au. So just to kick us off tonight, a bit of an agenda. We've got a how to use the Zoom platform in a second, and then we'll jump into our spotlight topic, which is all about professional indemnity insurance. Then there'll be time for some questions, and then we're just going to launch into a membership overview for those who are new members or who are not yet members or who are already members that want to refresh themselves with the different benefits of being an APNA member, and then we can take some questions towards the end. So if you're new to one of these APNA briefings, to use the Zoom platform, you can click on the Q&A button at the bottom and you can click to ask a question, and those questions will come up in front of our presenters this evening, and we'll be able to answer those as we go. So please jump into the Q&A function and ask away as we go. So without further ado, I'll hand over to Sam Moses, APNA founder, and Sam is going to tell us all about why professional indemnity insurance is so important for nurses. Take it away, Sam.
Thanks, Mitch. Hi, everyone. Thanks for giving up some of your time on a Tuesday night in the middle of winter to find out about professional indemnity insurance, which is really, really important, and good on you for being here because it's something that you really need to know about. So we're going to start by just giving you some idea around what APRA has to say about professional indemnity insurance. And as you can see up here, this is taken directly from the APRA site. It's national law that nurses and midwives must practice their profession in which they're registered with the appropriate professional indemnity insurance. So you have to have those relations in place, either with somebody that you work with or yourself. And we're going to go into that in a lot more detail. And we can be covered, as I said, by your own professional indemnity insurance or by the third party, which is the people who employ you. As APNA, as your peak professional body, we think probably one of the best things that you can do to protect yourself in this day and age in primary healthcare nursing in Australia is actually to have professional indemnity insurance in the form of a policy that actually you own and has got your name on it. Thanks, Mitch. We'll go to the next slide now. So APRA states that the professional indemnity insurance that you hold must meet these 4 standards. So it must cover you for all aspects of your practice and for any location where you're practicing, where you're actually working, and provide cover for you no matter which sector you're working in, whether that's private, non-government, the public sector. And it also must provide cover for you whether you're practicing in a part-time capacity, full-time, in a volunteer capacity. It doesn't really matter. It can be a combination of those things, but the insurance policy itself must cover you in all of those scenarios that I've just run through. Thanks, Mitch. So if you're covered by a third-party professional indemnity indemnity insurance arrangement, it's got to meet all of those 4 standards that I just mentioned that were on the previous slide. And if you've got any doubt about this, whether it meets those standards, you should always check what is covered. So that means you really need to have a look at the policy that you're covered by and make sure that it is protecting you. If the third party cover doesn't meet the standards of APRA, it's actually your responsibility, nobody else's, to make sure that you do have a professional indemnity insurance policy that does meet those 4 standards. It's not your employer's responsibility, it's the responsibility actually falls on you as the registered health professional. You're also required once a year when we do our renewal with APRA at the end of May every year, that you have to state and declare that annually that you do have some form of professional indemnity insurance in accordance with those standards that we mentioned before, and that you won't practice unless you actually do have these professional indemnity insurances in place. So that's one of the things that we tick, that we agree to do on our renewal every year. So a couple of real life scenarios that we just thought we'd mention just to give some context around the insurance. We had a nurse call our nurse support line, which I'm sure that if you're a member, you're familiar with, and if you're not a member, we have a nurse support line where you can call us up and ask us advice about all sorts of things. And one of the nurses who rang kept saying that she was covered with vicarious liability, and what that means is that the practice or the employer has taken out an insurance policy that covers you vicariously. Now, this nurse in particular kept asking, could she see it? And I'm sure this isn't the case all the time, but she wasn't allowed to see the policy. So she wasn't able to see whether or not her name was on the policy. So she felt very uneasy about the level of professional indemnity cover that she had. So she ended up taking out insurance through APNA with insurance.com.au. So that she had complete peace of mind knowing that she had a policy with her name on it. So that was one scenario. Another one was a nurse who worked in aged care, and so she was worried that in a 24-hour period, there'll be up to 3 nurses looking after any particular patient, and she was worried about how that would actually work. So she was covered vicariously by their insurance, but she felt that because they didn't know exactly who was on which shift, and her name wasn't necessarily on the policy, it was a broader policy than that the only way that she could again get peace of mind would be to take out a policy, because she felt that there could be conflicting interests, and that's another risk, I guess. The person that has their name or pays for the policy is always going to be the one who is covered more, I guess. And if you're not the person paying for the policy and it came to an argument or a disagreement or a misunderstanding or whatever it might be between the person who employs you, who pays for the policy, and yourself, then that's where it gets a little bit complicated, and the most simple thing you can do is to actually have your own professional indemnity insurance, and that negates that problem altogether. So I don't know if any of you have had some of these situations. Personally, I've had every single one of these listed on this slide. People will come up to you when they know you're a nurse and say, oh, can you have a look at this rash, or Johnny's got a rash, what do you think it is? That's one thing, let alone sitting next to people on an aeroplane. If you tell them they're a nurse, then you actually don't have to speak anymore for the whole flight, because they tell you their whole history, their whole medical history. I don't know if any of you have been in a public situation where somebody's gone down and had been having a heart attack and you've had to do CPR. Personally, I've had to do that twice in shopping centres until the ambulance arrived, or if they've had one of the AED machines. I've had neighbours who I didn't even know knew I was a nurse come running down and knock on my door and ask me for help. A couple of times a baby stopped breathing, a man was choking, all sorts of things. And not to mention the sporting injuries, if you're there with your kids and somebody hurts themselves or at my daughter goes to pony club, and so I was the nurse there, and anytime anyone hurt themselves, I was the first person that they'd come running for. And of course, post-op complications, if something goes a bit pear-shaped, they'll phone a friend, if it's friends or family, and get you to come and have a look and sort of sum up the situation for them. And so it's these, there is a word for it, Good Samaritan type situations where you aren't covered by a vicarious liability situation, whereas if you do have your own professional indemnity insurance, you will be covered for all of those Good Samaritan acts that you might find yourself performing, because we are, I think, the most trusted profession on the planet, from what I can recall. So we'll go to the next slide.
Nice one. Thank you, Sam. So what we will do, thank you for your time tonight, Sam. I will now throw across to the insurance.com.au team, formerly known as Insurance House, and they will go into the nitty-gritties around professional indemnity insurance and the legalities and all that sort of fun stuff. So over to you, team.
Yeah, thank you for the opportunity, Mitch and Sam, to speak to the APNA members this evening. We really appreciate it. Insurance.com.au, previously Insurance House. We're here to support you with your insurance needs and really focused on finding the right insurance solution for you as your profession changes, as regulation change, etc. Over the last 12 months, we've been, focused on building our own business to better support our partners. And I just thought it'd be worth mentioning that we're now part and owned by the Steadfast Group, which is an ASX listed top 200 company in Australia and the biggest insurance broking in the Southern Hemisphere, or at least in our region. So that gives us a lot of strength, gives us the ability to source the right products for you as needs arise. On the video session this evening is also David Chan, who joined our team very recently. He has over 25 years of experience in this space and has spent the last number of years really focused on insurance products tailored to specific groups. And today he'll be taking us through our solution in more detail. And of course, we welcome questions and any thoughts that you have. We may be able to answer those on the call today. If not, we'll definitely take those away and bring back, provide the answers following the session. So again, thank you. We appreciate the opportunity, and I'll hand over to David to take us through the information tonight.
Thank you very much, Dominic, and thank you, everybody. And it's a real pleasure to be here with you tonight on a wonderful Tuesday night and to share a little bit about professional indemnity, public liability, and product liability, and how that impacts each and every one of you and all of us as well. It's important on this day and age to have the peace of mind, ladies and gentlemen, to know that you're adequately covered and protected at work. Because as a nurse, you may be accused of unprofessional conduct in administration or in clinical roles, or perhaps inadvertently provide the wrong treatment to a patient, or you might be involved in a court case. So this is where your professional indemnity insurance can protect you and really come in and cover you if you're sued for negligence or malpractice, or if you're sued for damage arising from a public liability claim, or perhaps if you're required to appear before a court of law. This is where the policy that you've got here is right there to protect you and really is there to provide you that peace of mind that you're covered. Now, I've had a few people ask me, what's the difference between professional indemnity, public liability, and product liability? And I thought I would share with you tonight a little bit about all three, and then you'll see the differences there. Now, professional indemnity protects you for claims made against you in the course of providing your professional nursing services right here in Australia. Whereas public liability protects you against any liability if somebody is injured on your premises or while you're providing your nursing services somewhere in Australia. Product liability, on the other hand, protects you from claims made against you in Australia for any products that you sell or you supply to a third party. So that's the main difference between the 3 different types of covers. And the good news is, ladies and gentlemen, you're protected for all 3 with your policy here with us today. I would also thought I'd share with you another important point, just to reiterate what was brought up earlier by Sam, about the benefits of having your own individual professional indemnity policy. You see, group professional indemnity policies are purchased by employers on behalf of their employees, while individual PI policies are purchased by individuals for themselves. And it's tailored to your specific needs to provide coverage for all the services that you offer. Now, if you work as a contractor or you're self-employed, you will definitely need to have your individual policy to ensure that you have adequate coverage. Even if you are an employee and if your employer may already have purchased a group policy for you, you should still consider having your own policy, because having your own policy provides you with a peace of mind as you perform your activities, whether as an employee or self-employed enrolled nurse, registered nurse or nurse practitioner. And more importantly, that's that reassurance of knowing that you can seek your own assistance and your own legal representation, whether it be for a complaint dealt with by APRA or a coronial inquest, for example. And let's face it, having your own policy also ensures that your interests are served, especially when there's a conflict that arises between your version of events and that of another practitioner or your employer. All right, so I think that's very important to consider that, and we believe having your own policy makes a lot of sense. So what does professional indemnity insurance cover you for? Well, as mentioned earlier, we provide all 3 in one in the policy: the PI, the public liability, and the products liability. And as you know, it is required as a registered nurse to have the adequate and appropriate professional indemnity cover in order to practice. What it does cover you for are things like defense fees, settlements in event of claims investigation costs, right? Those are the costs incurred in investigating and defending your claim. And ladies and gentlemen, these costs can be quite substantial. Recently, there was a claim where, somebody had a claim investigation cost fees, and that can be $7,000, $8,000 right off the bat. Public relations costs, for example, also very interesting. Fees that you may incur to rectify your reputation, right? In order to hire a PR agency to help protect you and to help defend you. So all of these covers are provided with your professional indemnity insurance cover. Now, what's included in your policy? Number 1, you have a choice of cover, right, for both professional indemnity and public liability. And the policy that you've got here either gives you a choice of 10 million professional indemnity and public liability, or 20 million professional indemnity and public liability. And the good news is, if you choose, let's say if you choose 10 million cover, you cover for 30 million in the aggregate, multiple times a year if there's a claim. If you choose a 20 million cover for PI and public liability, you're covered in the aggregate up to $60 million. On top of that, we provide cover for Good Samaritan Acts. Now that's a very, very good thing. And you've got peace of mind that if you have to provide any emergency first aid or medical assistance services administered at the scene of the emergency or the accident or the disaster, you're covered. You're protected. You're also covered for costs of attending inquiries, the legal defense costs in that. You're covered for runoff cover as well. Runoff cover continues to protect you if you need to provide cover for allegations of professional negligence after you're no longer practicing or have retired. These allegations can come about unexpectedly, of course, and you may find yourself needing, out of pocket if you need cover for runoff cover, and that's where the cover is there. We also provide investigation costs to cover your legal costs and expenses in responding to an investigation from an official body or a complaint made against you to your nursing services. We also provide cover for defamation, and that protects you against claims resulting from making a defamatory comment or statement or something that harms somebody's character. And it's good to know that you've got that level of cover there. On top of that, you've got value-added benefits. And it's quite exciting to be able to say you've got cyber liability cover up to $25,000. And cyber liability protects you for first-party hacker damage, for example, against you or your website or your system. Covers you for third-party liability for claims against you against third parties. And things like computer virus, where perhaps inadvertently you might be responsible for the transmission of a virus. So range of covers there. Cyber liability is covered up to $25,000. top of that, you've also got complimentary legal advice. All right, that's free legal advice. You can give a call up to 30 minutes, free legal advice, and that's important when you need to find out what your options are. You have access to a whistleblower hotline, and that's provided there for you. And on top of that, you've got cover for restoring or replacing your lost or damaged documents. Now, if you ever call to attend court and you're going to make an appearance there, you've got up to $250 per person per day, up to $10,000 per claim. And if you're a student, we've got cover for you as well, for you as a student while you're an employee. On top of that, there is statutory liability cover of up to $50,000. Now that protects you for costs and expenses incurred by official investigations or inquiries against you for any allegations or wrongful breaches of key legislation. On top of that, you've got cover for basic cosmetic injectables, such as Botox or fillers, if they're prescribed by a qualified doctor. So the wide range of value-added benefit there. And again, for all your policy coverage and conditions, please feel free to refer to your policy wording or PDS and the general terms and conditions. We've just extracted some of the key value-added benefits and coverage that you have available to you. I thought I will also share with you tonight, ladies and gentlemen, some exclusions, right? So you've seen what we've covered for you. Here are some of the typical exclusions that we have selected, some examples. For example, in the case of abuse or dishonest or willful acts, or alcohol and drugs, bankruptcy, insolvency, or if there are any prior reported or known circumstances that may arise, these are typical exclusions that are there in all policies basically. Assumed liability is also there for you not to enter into any agreement where you're taking on additional liabilities, so something to be careful there. And there's also, we thought we'd mention a midwifery exclusion, where you're not covered for any claims arising directly or indirectly in connection with the provision of midwifery services. The good news is that antenatal or postnatal nursing services, that's okay, that's covered, right? It's only the actual midwifery services in there that you need, cover for separately. So these are the exclusions there typically we have, and we've shared with you, ladies and gentlemen, what you're covered for and all the value-added covers. So it's very exciting that we're able to provide this, and we're open to taking any questions now. So if you have any questions, please feel free to type it in, and we'll have a look and try to answer as many as we can tonight.
Thank you, David. That was really helpful. And we've got a couple of questions coming in. I'll answer the first one there from Miriam. So the question is, how much is professional indemnity insurance? So as an APNA member, you have the right to buy this special policy that we have negotiated with our friends at insurance.com.au. So you need to be an APNA member to be able to buy the policy. The policy is only $149 per year, which Sam just did some nice sneaky maths for us. So that's $2.87 per week. So it's very reasonable. So it is $149 a year on top of your professional membership, or if you're a corporate membership or an organization membership, you can also get insurance as well. So it's on top of membership, but it's $149 a year, and it's prorated. So depending which month in the year you purchase, depending how much you pay. So it's currently $100 to add on the professional indemnity insurance on top of your membership, and that cover will take you all the way through till the 31st of March 2024, and then you'd basically go back onto the it'd be $149 for the following year after that. So there's a couple of questions in there for David. If you'd like to jump on in, please feel free to have a look at some of those and jump on in if you would like to have a bit of a look. There is a question in here from Kathleen around guild insurance. So you'll have to have a look at the policy, but from my knowledge, guild insurance is a group policy, not an individual policy. So David, or maybe if you can just expand on the difference between a group policy and an individual policy, if you don't mind.
Sure, absolutely. So group policies are purchased by your employer or the practice itself on behalf of the employees. And typically this would be like a master policy or group policy, as they say, and it's priced based on the risk profile of the group as a whole. Individual policies are for you, right? That's covering you specifically. Now, if you're a contractor or if you're self-employed, you'll need definitely to get your own policy. But if you're an employee, your employer may have purchased a group policy already covering you. The challenge, I guess, and we saw an example earlier, is that you're not sure whether what the cover is like. You need to find out a bit more about the adequacy of cover. And the key point here as well, as I said before, you want to make sure that you're covering your own interests as well, right? For example, if there's a conflict that arises between your version of events of what happened versus another person within the practice or your employer itself, you've got 2 or 3 different versions of events, at least you really want to have that peace of mind, right? That peace of mind to know that, hey, I've got my own cover. If I need to get my own representation, I can do that under my own policy. So that's the benefit of having that your own policy itself, which I think, again, for the price itself, as Mitch mentioned, it's certainly a good value for the additional peace of mind. There was a question here as well talking about, what protection is there for the individual nurse if the employer seeks to recoup the costs from the claim against the individual nurse if the nurse does not have their own PI? That's a very good question. And I think the best answer to that is to say, please consider having your own PI because you'll know that you have got cover there. Now, if the employer seeks to get rectification or get some cover of costs or recoup against you, then I think that's something that where I would recommend you do have your own policy in advance, right? And making sure you've got cover there. We've got a couple of other questions here. Let me have a look at that one here.
I might just grab one here. There's a question about how does the PI cover provided by nursing union protect an RN, EN or AIN? The PI covered by a nursing union is a group policy, so it's not usually an individual policy like the APNA policy is. You'd have to look at exactly the ins and outs of the wording of the policy, but it is a group policy, so it's not necessarily in your own name. You don't control it, and all those different benefits that David just outlined sort of are in the in play in that case.
Great, thank you, Mitch. Interesting question here. Could you please expand what the cosmetic injectables mean as part of the value-added benefits? Happy to do that. So, if, for example, there has been some sort of cosmetic procedure or injectables like Botox or fillers that are prescribed by a qualified doctor, and you are the one who's providing the injection itself or providing that service there, you're covered, right? As long as they're prescribed by a qualified doctor, you're providing the service as part of what you're qualified to do, then, cosmetic injectables, Botox, fillers, that kind of thing, that's covered under the policy. Again, 2 things. It's been prescribed by a qualified doctor and it's within what you're qualified to do as well. So thank you for that question there.
There's a question here also, how do you choose the higher level of liability cover and what does that cost? So that's on case-by-case basis. And if you get in contact with the membership team, so just the membership at apna.asn.au, the team can put you in touch with Insurance House now, insurance.com.au, to be able to work out what that cover would look like. But the $149 per year is for the 10 million cover that we were talking about before. There's also a few other questions in here around scope of practice. And Sam, if you don't mind having a look, there's a question here. I don't know if you can see the Q&A there, Sam, from Michelle. Maybe jump in and if you don't mind having a bit of a look at that one.
Sure. There's a couple here that I'll just answer very quickly as well. There's Tinu. Yes, if you have this professional indemnity insurance, as I mentioned before, you will be covered outside of the workplace if you have to do CPR, provide emergency help. So yes is the short answer there. Was it the one from Deborah who works in a school? Deborah, just quickly, yes, if you one nurse and 820 children, you need to have hats off to you anyway, let's say that. Yes, this insurance would cover you at that ratio as long as you are working within inside your scope of practice. You must work within inside your scope of practice.
There's a question here about ear syringing from Michelle in the Q&A there, Sam.
Right, I'll just find it.
Yeah, so does it automatically cover everyone's scope of practice, including ear syringing, or do you need extra cover? No, the APNA member professional indemnity insurance provided by insurance.com.au does cover ear syringing. There was a different insurer last year that decided to stop covering that. But do you have anything else you want to say around that, Sam?
Sure. Look, Michelle, that's a good question. So basically, yes, this cover will cover that. However, it must be within your scope of practice. And what that means is you have to be, authorised to do it. You have to be educated to do it, confident and competent to be able to perform the procedure that you're performing. And if you were using something that you were just sort of jammying together out of your treatment room, like a 60 ml syringe, God forbid, and you weren't using the appropriate tools to ear syringe, then you might run into some trouble there. So you've got to use the right equipment, obviously, and you have to be educated, and it has to be within inside your scope of practice to be able to do it. So I hope that answers that question for you.
Yeah, definitely. And there's a question in there from Kate around Good Samaritan Acts and, the thought that they were protected if providing assistance under the Act. That is the case, but the Act clearly talks about providing advice, assistance or care if there's a risk of death or injury. So if we talk about all those other things, like, is this a rash, or is, any of those other sort of scenarios that Sam talked about, having your own policy is definitely a good idea there as well. Yeah. Marie's also just asked around ear syringing covered. Is ear syringing covered? Yes, it is covered under this policy. Kate's asked about outreach nurses and if it's covered at various locations. Yep. It's covered everywhere in the world except for USA and Canada. So unless you're practicing in one of those two countries, Kate, yes, you're covered anywhere in the world as long as it's inside your scope of practice. Any other questions there, David, that you've seen that you think you'd like to give an answer to?
Sure. A question from Kathleen. I'm a registered GP practice nurse as well as a health coach on business. Can I go with your insurance company? We'll take it offline and we'll be in touch with you on that one. But we need to understand a little bit more about what your own business is. But certainly we can do our best to help you in that situation with your own policy as well. As a health coach. So we'll come back to you on that one and we'll reach out to you.
I guess Miriam's asked about ear syringing becoming such an issue in general practice nursing field. Look, it always has been, Miriam. It's highly litigious because there's a lot of things that can go wrong with ear syringing. So you really have to know what you're doing and what you're looking for. So it can just be complicated. I think it's something like 1 in 1,000, or it used to be anyway, last time I did a bit of research, 1 in 1,000 ear syringing processes, something goes a little bit pear-shaped. It mightn't be, completely bad, but things like rupturing eardrums and doctors have done a whole heap of, there's a whole lot of stuff that can go wrong with ears. Anyway, I won't go on about it, but it's just always been a little bit litigious, I guess. And also just with the Good Samaritan one, I think more and more we're seeing people try to sue people in Australia for different things. And the Good Samaritan Act is absolutely there and it exists, but there's a whole lot of loopholes that having this insurance would protect you from. So if you think about a sieve, this will put a another bowl underneath that sieve, so that if there's any situations or scenarios that could get through the Good Samaritan. I haven't got a good example to talk to you about, but it just catches that, and it's a bit of a protect-all for you as long as you meet the criteria and you're working with inside your scope of practice. So we all always have to remember that with insurance or anything else that we're doing. It's not just insurance. We must always work with inside our scope of practice as registered nurses and enrolled nurses, midwives and nurse practitioners.
There's a question in here from Janine about paying off monthly with your APNA membership. So currently you can only pay off the professional indemnity insurance in one bulk lot, but starting next year, we hope to be able to offer monthly instalments along with your APNA membership. And yes, Gay said you can claim the professional indemnity insurance as a tax expense for sure. So that's another thing as well. There's a question in the Q&A there, Jack, that you may want to have a bit of a, David from Jack, that you may just want to have a bit of a look at, if that's okay. While I just answer a question from Kate, there's a question from Kate around provision of journey cover as part of New South Wales nursing NWA membership. Kate, I'm sorry, you'd have to have a look at the policy. I can't answer that one just because I don't have the policy in front of me, and you should have a bit of a look at that one. David, do you mind having a quick look at that one from Jack in the Q&A? If you're able to have a look at that one, that'd be great.
Absolutely, thanks, Mitch. So Jack's a registered nurse and a qualified lymphatic practitioner. If you open a private business, yes, we can. We'll make contact with you on that, and we can certainly discuss how we can provide some cover for you, Jack, in terms of the business that you want to operate as well separately. So we're happy to reach out to you and have a discussion about the services that you're offering and understand a little bit more about the business and what your needs are, and we'll have that conversation with you, Jack. Absolutely.
I think Eugenie's question might be something that needs to be taken offline as well. They're doing Chinese medicine as well as some other things. So maybe that's something that's for a conversation with David.
Absolutely, absolutely. We can discuss that as well. Again, if you're a Chinese medicine practitioner, we do have some covers for you as, both from a PI and liability perspective. We'll just need to understand a little bit more about what you're doing, and we can certainly understand and have a conversation about what your needs are. Sure.
Beautiful, thank you. We just have one last question here from Susan. Is travel to and from work covered if you have an accident? David, I might just let you answer that one.
Well, professional indemnity and public liability insurance cover is a little bit different from your traditional work cover. So it covers you for negligence and that kind of thing, as we mentioned before, or claims against you. So that's what it's for, against negligence and malpractice. It's a little bit different for covering for you when you're traveling to and from work if you have an accident. In that situation, you might need to have a read about your employer's work cover situation. Or I understand recently there has been some questions around whether you're covered outside of work when you're traveling, and there's a bit of question mark around that. One thing I do want to say as well, it's good to have your own personal accident cover. If you are thinking about having cover for accidents and PA, it's good to have a personal accident cover, and that's widely available as well, and from multiple sources.
And it does change from state to state as well in terms of work cover. So it's most likely a good idea to have a bit of a look into what is covered in your state as well.
Yeah, that's a good idea. And also if you're traveling, if you're just going from home to your place of work, may be different from if you're going from work to, say you were doing home visits or something like that, and then you were going from home visit to another home visit, then that situation may make it a little bit different as well. So there's not a really simple answer for that one. It's not yes or no there.
Mm-hmm.
So we might just leave the Q&A chat open until we finish up tonight, but I'm going to throw over to Carly Catalano here, our membership and engagement manager, and she's going to give us just a rundown of APNA member benefits, so that everyone is sort of across this. So this is a good idea for if you are an APNA member to review your membership benefits and what you have access to. If you're not yet an APNA member, it gives you an overview of the different benefits benefits that that you can have access to, and definitely if you're a new member, so that you can see what you can get into. So I'll throw over to Carly, and then we can answer some more questions. So keep popping your questions in the Q&A, and we can answer some of more of those questions in a few minutes once Carly has given us a bit of an overview of APNA membership.
Thanks, Mitch. Thank you for that intro. So with our APNA membership, we have a range of benefits for you, so much so that we've had to kind of create 4 buckets, I suppose. So what I'm going to go through tonight is the up-to-date education resources, the latest industry news and guidelines, communities, expert advice and support, as well as insurance, which we've discussed, advocacy and perks. So firstly, we'll talk about up-to-date education and resources. So first off, we have online learning. So this one was something that definitely was quite the spotlight during COVID, but since then it has been a real focus for us at APNA. So we've got around over 200 hours of online learning available to primary healthcare nurses. It's a really good and very valuable resource for you, and members, you do get discounted or free learning resources there. Another one we've got is Nursing Australia podcast. This is a really good one because it also can be used for CPD. So you can be walking around the block or just having some time out, folding, washing, whatever you do in your personal time. And it covers a wide range of industry news and information around primary healthcare. Another one we've got is educational events such as this one. So we do APNA briefings. We had a big festival of nursing that happened in July in, where was it? It was in Western Australia. So that was a massive, massive event, and I'm sure some of you would have gone. It's just a really great excuse to get nurses together in the same area, have that conversation, have that social outlet, and just kind of you know, network with people. Another one as well is nurse know-how videos. So these ones are bite-sized educational content, usually delivered by APNA nurses, so APNA staff, and just about all things kind of primary healthcare and your day-to-day activity. Let's go to the second bucket. So we've got the latest industry news and guidelines. So not being biased, but one of my favorites is definitely the Connect. So this is something that my team really do focus on. So we've got a weekly newsletter that gets delivered to your inbox every Monday at 5:30, basically summarising all of the primary healthcare information, publications, resources, downloadables, absolutely all those resources that you need to do your day-to-day job every Monday. It's awesome. So if you haven't signed up, Mitch will put a subscribe link into the chat. Another one as well is the Primary Times. So this one is a tangible membership offering, I suppose. You get like a newspaper delivered to you to your actual mailbox twice a year. So it's got industry resources, news publications, it's a journal. Basically, primary healthcare, again, a really good resource. And I know that a lot of people do enjoy receiving that. One that we haven't really used lately, and that's not a bad thing, is the primary healthcare breaking news and alerts. So this one we did use quite a bit around that time where things were changing 3 times a day. It was very hard to find out when that information was kind of breaking, where it was coming from, especially for those that work on their own, didn't have that person to bounce off. So we were sending communications to our members, and also I think not just to our members, to be honest, but just to make sure that they were aware of any changes happening within COVID. We have Knowledge Hub. So I like to see Knowledge Hub as the Google of primary healthcare. It's just all resources primary healthcare. Next one. Cool. So communities, expert advice and support. So one of my favorites is the nurse support line, as Sam did mention earlier on tonight. Basically, I'm not going to say it's phone a friend, but it's definitely, you have that ability to contact one of our nurses, an APNA nurse who's worked in primary healthcare, understands it, and you can ask them questions about, you know, there might be a gap in a resource that you might be, you know, needing. You might have questions. Again, a lot of you work on your own. If you're a school nurse, for example, you need to bounce those questions off somebody. That's what we're for. So it's a really, really good way to get that information that you need straight in your inbox. The team are exceptional. Nurse talk and networking. So again, similar to what is happening tonight, this year we've really focused on having APNA events. We want to go face to face. We really want to get people involved, have that two-way conversation. So we've had a few calendar events this year. We've discussed vaping. What else have we discussed? We are discussing mental health next week. So these events happen in person. We might have live sites, which is where we'll stream it, still a face-to-face kind of event. Think cheese platters, think wines, think nurses, conversations. It's, again, a social way for people to get together and discuss primary healthcare. Online communities. So this one here is a really good resource for, you've got a quick question, you need a quick answer. For example, we've got our Facebook member page. So that one there is, I think you've got over 8,000 people there that love to help each other. Ask a question, you're going to have like at least, 10, 15 responses quite instantly as well. So that's a really, really good resource for primary healthcare nurses. Okay, out of breath, there is so much. So we're on to the last bucket, which is the insurance advocacy and perks. So your CPD portal, we've got that there for you just to log all of your CPD online. So if you ever need to kind of show somebody that you've got that information, it's there in one spot. You don't have to fumble around, go through any kind of items that you might need to kind of find a certificate or something like that. Professional indemnity insurance, of course, that is a feature of your membership. We have your career and education framework and tools. So basically, this just maps a nurse's career and education. Nurse awards, of course, we want to reward our nurses. So this is a yearly event. We have a team dedicated to advocacy. So we have we have a good team dedicated to advocacy. So they're getting primary healthcare nurses front and centre. It's not just about hospital nurses. Like, we are making sure that primary healthcare nurses are being heard, and we do that on a daily basis. If you turn on the radio, ABC, you're going to hear Karen Booth. You're going to hear somebody, even Sam, talking on the phone, on the radio. Rewards and discounts. So pretty happy to announce that we do have a real person that's come on, a good organisation. So Blue Light, for all members, you are getting discounts on items such as Woolworths gift cards, the Iconic, JB Hi-Fi, so that's a member benefit. We've got the advisory nurse panel. So that is basically, if you want to have your voice heard, if you want to help support, this is something that you can definitely do. And last but not least, the negotiation guide. So this is here just to help you have some framework of how to be assertive and get what you want. It's not necessarily based about pay, it can be about other things as well, but definitely a good resource to have up your sleeve. And I'll leave it at that, but questions? I think
we've answered. We've done such a good job tonight. We've answered all the questions. There's no more questions left in the Q&A, and we've pretty much answered all of the questions in the chat as well. So we might just wrap up this evening and say thank you to everyone for coming this evening and joining us to hear about professional indemnity insurance and also about APNA membership. Thank you, Dominic and David from insurance.com.au for being here, and really appreciate that. So thanks everybody for being with us this evening, and I hope that everyone has a lovely evening, and take care. Thanks so much.